So there are in fact two different types of valves. There are mechanical valves and there are tissue valves. Mechanical valves are made of carbon and titanium. We often hear them referred to as the metal valves. There's not really that much metal in them, but it's easy to refer to them that way. The other types of valves are tissue valves. They can be either the pig valve or very commonly they're made from cow tissue or what we call bovine pericardium. And these are treated so your body does not reject them like they're from another animal, but these are tissue valves and they'll open and close and function very well. All tissue valves, though, have a certain lifespan. That lifespan depends on the age of the patient, other medical conditions, the use, whether they get infected or not. So these things can reduce the length of time these valves will function. The Percival heart valve produced by Sorin is quite dramatically different than any other valve that's preceded it. The tissue that it is a type of tissue valve. It's made from bovine pericardium, which is this cow tissue. So that's a tissue that's been very standard and proven to last over many, many years. What's dramatically different about the Percival prostheses compared to all the other valves that have gone in over the last 50 years is that it does not require any sutures to hold it into position. So all the time that's consumed in putting sutures in through the patient's heart, the sutures through the valve, tying them into position, all that time is eliminated with the use of the Percival valve. Something that is also with the design of the Percival is that the cage, the little cage in which it sits in, is very, very thin. So what that means is that we can get a very good sized valve opening in for the patient. Remember, aortic stenosis is a condition where the valve is getting tight and narrow. We want to recreate for the patient a nice big opening. When you put in other styles of valves that have stents, which are posts where the valve is hooked onto, they occupy space. The Percival doesn't have those types of stents, so it occupies less space. There's more space just for the opening of the valve. So the relief of aortic stenosis, the benefit of getting rid of that aortic tightness, is better size for the Percival than standard stented valves. The beauty of the Percival valve is that it's really suitable for everybody that's suitable for a tissue valve. It is ideally suited and was created for patients that have a high-risk profile. So we know that elderly patients, if you have bad lungs, if you have bad kidneys, if you have these things, then keeping on a heart-lung machine for a long period of time increases your risk of kidney failure, stroke, all these bad things happening. So the Percival can be implanted very quickly in those patients, so it reduces their risk. The Percival valve, because it is designed differently, gives you a better opening than the old style valves. So in those patients, it's incredibly useful in minimizing the operation.